It's not where you think. For years, men have been told there's a secret spot, something hidden inside the body that, if you just find it, unlocks unimaginable pleasure. But here's the truth. After 60, what really matters isn't finding a spot. It's understanding what's happening beneath the surface. I'm Dr. Emily Carter, and in this video, we're not just talking about anatomy, we're talking about connection. Because the so-called G-spot isn't a button you press. It's a deeper part of how a woman's body and her heart respond to trust, patience, and presence. So before you rush to find it, I want you to pause for a moment and ask yourself, when was the last time you actually studied her body the way you did when you first fell in love? If you're like most men, it's been a while, and that's okay. You're about to rediscover something you didn't lose, just forgot how to see. Most men think the G-spot is a tiny magic button hidden somewhere waiting to be pressed just right. But that idea has confused couples for decades. In truth, the G-spot isn't a switch you flip. It's part of a larger living network. What we call the G-spot is simply one region of the clitoral complex, a structure that stretches deep inside the pelvis like the roots of a tree. What you see on the outside, the small pearl of skin at the top of the vulva, is only the tip. Beneath it, two internal arms called crura and two bulbs called vestibular bulbs wrap around the vaginal opening, forming a 360-degree system of sensation. When someone says 2 to 3 inches inside toward the belly button, what they really mean is you're reaching the inner side of that same network, the place where the internal branches of the clitoris can be felt through the front wall of the vagina. That's why pressing harder or faster doesn't unlock anything. Because you're not hunting for a hidden button, you're learning to tune into the rhythm of blood flow, nerves, and trust. So when men tell me, "Doc, I can't find it," I tell them, you can't find connection. You have to create it. And once you do, the body responds in ways no map could ever predict. Here's something most men never learned. Not from health class, not from movies, not even from experience. Arousal isn't a light switch, it's a wave. For a woman, everything builds gradually. Warmth, breath, heartbeat, trust. It's not about where your hand is, it's about where her mind is. When she feels safe, her body begins to open. Blood flows into the clitoral network. Those internal bulbs start to swell. The tissues of the vaginal wall become thicker, softer, more responsive. The G-spot area actually changes. It goes from smooth and flat to slightly raised, spongy, almost like the roof of your mouth. But when there's no arousal yet, pressing on that same area can feel like nothing, or worse, uncomfortable, like pressure against the bladder. That's because stimulation only works once the body is ready. And readiness doesn't start with touch. It starts with connection. The glance across the room, the calm in your voice, the patience in your hands. All of that tells her body, you're safe, you can relax, you can feel. Once you understand how arousal builds, touch stops being guesswork. It becomes communication. Most men make the same mistake. They rush. They move too fast, too hard, too soon. Maybe it's nerves. Maybe it's what they've seen in movies. But real pleasure, especially after 60, doesn't come from speed. It comes from steadiness. The G-spot responds best to pressure, not pounding. Think of your fingers as an instrument, not a tool. Start with a slow, come here motion. Gentle, firm, deliberate. You're not trying to do something to her, you're doing something with her. If you feel the tissue change from smooth to slightly textured, stay there. Move with intention. Small circles, side to side, or even steady pressure that you hold, letting her body react in its own rhythm. And this is the part men overlook. Your real feedback isn't what she says, it's what her body says. Her breath deepens. Her hips tilt toward you. Her muscles relax instead of pulling away. That's how you know you're in sync. Here's the truth that surprises most men. The G-spot is powerful, but it's not the whole story. Research shows that nearly 80% of women reach orgasm primarily through external clitoral stimulation, not penetration alone. That doesn't mean you failed if she doesn't climax from the inside. It means her body is wired differently. And once you understand that, everything gets easier. Think of the clitoral complex as a network with two doors. One you can reach from the outside, the small, visible tip. The other you reach from the inside, through the front wall of the vagina. When both are touched, the nerves fire together, creating a fuller, deeper wave of pleasure that travels through her entire body. That's what dual stimulation is. Not doing more, but connecting both sides of the same circuit. If you're using your hands, one can apply gentle internal pressure, while the other stimulates externally. Light, rhythmic, steady. If it's during intimacy, try positions that give her control. When she's on top, she can adjust the angle to find what feels right. Or, if you're in missionary, place a pillow beneath her hips. It subtly shifts the angle so the front wall meets more contact. Every man wants to know where the G-spot is. But the truth is, the most powerful spot isn't in her body, it's in her mind. Because when she feels seen, safe, and wanted, her body naturally opens. No pressure, no guessing, just connection. Most couples never talk about what actually feels good. They stay quiet out of habit or embarrassment or fear of hurting each other's feelings. But silence is the enemy of discovery. So start small. You can say something as simple as, "I want to explore what feels good for you. Tell me when something feels amazing, or when it doesn't." That single sentence changes everything. It turns intimacy from a performance into a partnership. It removes the pressure to get it right and replaces it with curiosity. Encourage her to describe what she feels, not just good or bad, but how it feels. That's warm. That's too intense. That feels different. Let's talk about what really changes after 60 and what doesn't. Aging doesn't take pleasure away. It just asks you to meet it differently. As women move through menopause, estrogen levels drop. That means tissues may become thinner, drier, or more sensitive. Blood flow takes longer to build, and arousal might need more time, or a different kind of touch. But that's not decline. It's evolution. Her body isn't losing desire, it's asking for patience. And when you meet that need with gentleness instead of pressure, something beautiful happens. Intimacy becomes slower, deeper, and more meaningful than it ever was when you were younger. Use a high-quality water-based lubricant. Keep the environment warm and comfortable. Take more time for foreplay. Not just minutes, but moments that linger. Sometimes just kissing without an agenda can awaken more arousal than anything else. And don't forget, her hormones aren't the only ones that change. Your own testosterone levels shift with age too. Energy, mood, and stamina can fluctuate. That's why real connection after 60 isn't just about physical response, it's about teamwork. When both partners slow down and adapt together, intimacy becomes less about performance and more about presence. You're not chasing youth, you're building something wiser. When couples have been together for years, routines begin to form. In daily life, in conversation, and yes, even in intimacy. And while comfort is beautiful, routine can quietly dull desire. Here's the secret most long-term couples never learn. Desire doesn't disappear, it just needs novelty to wake it up again. That doesn't mean you have to reinvent everything or chase something wild. It means bringing back curiosity. The same curiosity you had when you first touched each other. the thrill of not knowing exactly what would happen next. Variety doesn't have to be big. It can be as simple as changing the pace, slow one night, playful the next. Try a different time of day, a different setting. Dim the lights, add music, or even start with a walk before anything else. Those small changes reawaken the mind, and the mind drives arousal far more than the body ever does. You can't separate sexual health from overall health, because the same systems that keep your heart beating keep your passion alive. When circulation slows, when energy drops, when stress builds, intimacy suffers too. It's not just about testosterone or hormones. It's about how well your body moves blood, handles stress, and finds rest. Every part of you is connected. A strong heart supports stronger erections. Balanced blood sugar supports stable mood and desire. Good sleep boosts testosterone and energy. Even simple things, walking, stretching, breathing deeply, improve blood flow to every organ, including the ones that matter most in the moments that count. So where is it, this mysterious G-spot everyone talks about? It's not hidden in some secret corner of the body. It's right there, in the connection you build. It's in the way you listen when she speaks, the way your hand slows down when she exhales, the way you let go of ego and reach for understanding instead. So tonight, don't search for the G-spot. Search for understanding. Search for trust. Search for the rhythm that only happens when two people stop pretending and start being real again. Because that quiet, patient, beautiful moment when you both exhale together, that is the spot everyone's been looking for. And once you find it, you'll realize it was never lost.